For me, you may just hear the term, but you don't hear the term. It's one of those things that will blow by like the wind. So what is pelvic floor?
Yes. So pelvic floor, it is the group of muscles that attach in your pelvis. So your pelvis is the bone that attaches your back to your hip muscles. So if you like put your hand on your hip, those are the top of your pelvic bones. So the muscles of the pelvic floor are the ones that attach. They lay like a hammock across those bones, and they work on, they're both in men and women. I specifically treat mostly women, but they are in both men and women. So they affect things like sexual function as far as pleasure, arousal, ability to have an orgasm, urinary continence, so ability to hold back urine with leaking, coughing, laughing, sneezing. They affect things like ability to hold your pelvic organs up and in. And so when those start to fall out, that's called a pelvic organ prolapse. So for women, what that feels like is something falling out of the vaginal canal. So it feels like a bowling ball falling out or a tampon falling out when you're not actually wearing one.
Wow, that's deep. I am Hayzel Green, an inquisitive, unapologetic, voluptuous introvert who blooms and blossoms behind closed doors. This is my podcast, a platform where I will discuss my writings and where I will bring to light conversations with my good girlfriends, sisters, brothers, and homeboys about love, life, music, and most importantly, sex. So leave your judgment at the door and welcome to Hanging Out with Hayzel.
It's Hayzel, baby.
How do I get pelvic floor?
Everybody has a pelvic floor, and I think you're probably asking what causes that to not work correctly. Is that correct?
Correct.
Okay. So there's 1,000 different things that can make the pelvic floor not function optimally or the best that it should. A lot of times it happens during pregnancy, and people often hear that term and they think, oh, I have it because I was pregnant. But like I said, men can have it too. You can also have issues with those muscles not working the way that they should without ever having babies. So it could be things like not pooping correctly. It can be things like lifting heavy weights incorrectly. It could be like I've treated ballerinas who are constantly doing things on one leg. You're pirouetting on one leg over and over and over again. So you end up with this imbalance from one side to the other. So it can affect all of those functions that we talked about, bowel, bladder, sexual function, because the muscles aren't working the same left or right.
When a woman has incontinence, and me and my cousin, we just joke about this all the time, whether we sneeze, whether we cough, whether we laugh, some urine escapes. Is that something that could generally just happen, or is it a result of pelvic floor not, I don't know why I want to say functioning correctly.
That's a great way to put it, yeah.
You can have bowel incontinence.
Urinary incontinence is more common. So you were asking about if that is because of a pelvic floor dysfunction or not working correctly.
Yeah.
Usually, yes. There could be other causes. Typically, it is because the muscles are too tight, which people often think, well, I'm supposed to have a tight pelvic floor. Like from a sexual function, that's what we think of is, oh, it feels better when they're tight, right? So when there's leaking, a doctor will say, oh, just do 100 Kegels. That'll fix it. And the Kegels, are you familiar with what a Kegel is?
Yeah.
Yep, there's the devices, or there's just using those muscles to contract themselves, kind of like I squeeze those muscles to stop the flow of urine or to stop a bowel movement. And when you do those repeatedly, it can make that leaking work. So those muscles end up too tight, and then there's nowhere for them to go. It's like they're already fully contracted. So when you have this forceful movement, and I go to lift something heavy, like my child off the floor, or I have a big sneeze, those muscles are already fully contracted. So there's nowhere else for them to go. So the urine can just pass right through because those muscles can't function anymore. Sounds pretty crazy, right?
Yeah, because now you're telling me from what I've learned in the past, doing Kegel exercises, tightening of those muscles is not necessarily a good thing.
Correct.
Oh my goodness. And I know I'm going to be all over the place because this is just so interesting to me. When you're having sex and the guy say, squeeze it or tighten it, that's what it is that I will be tightening at that time is the pelvic muscle.
Yes.
Which at some point during my life, doing that to please him would jack me up in the future.
No, not necessarily. Doing that during intercourse is okay. And doing Kegels is not a bad thing, but the problem is that most people can't then un-Kegel. I'm going to make up a word. They can't figure out how to relax those muscles. So we stay in this super tense state, and those muscles can't function then correctly. So think about if you had, I don't know, you were trying to hold a gallon of water in your arm, but like if you're holding it up and you're just holding it there in this contracted state forever, you wouldn't be able to then straighten your arm out to tie your shoe because it'd be stuck there from holding it for so long. And that's where our pelvic floor muscles end up, is in this stuck state of contraction, and they can't figure out how we work to relax and contract like they should.
Are there exercises or something that you would suggest that a female do in order to help her symptoms or help rectify what's going on? Can it be repaired? I guess that's the question.
Yeah.
Okay.
Yep. So typically, let me just give you a little background so it makes sense here for me. I treat patients in the clinic as a physical therapist. I also treat women online and do health coaching for a lot of things like incontinence, painful sex, those kind of things. So I have kind of two different realms of my world. In a physical therapy clinic, we do hands-on things. So I would do like vaginal work with a finger where I would work on those muscles. So think about if you had therapy for neck or shoulder pain, we would do hands-on to relax those muscles. Sometimes in the pelvic floor, we have to do that to manually massage to get that tension and that like muscle spasms out of those muscles internally. And then there's also, we work a lot on breathing. So your diaphragm, which is what moves up and down when you breathe in and out, that attaches or works with, not attaches to, but it works with your pelvic floor. So exercise-wise, we work a lot on getting your breathing pattern right so that your pelvic floor works right. When one goes up, the other goes up. When one goes down, the other goes down.
Back to the physical therapist part of it. In the event that you are wearing your physical therapist hat and you have to treat a patient with pelvic floor. And again, we're talking about females. Now, I understand that men can suffer from pelvic floor, but we're not talking about men right now because I'm interested as a woman, a male. If you want to find out how pelvic floor affects you, we can always reach out later. Let me know, drop something in the comment and say, hey, Hayzel, I want to know about pelvic floor in a man. And maybe I need to find out too, just so that I'm not ignorant to it. And I just know, yeah. And see, I go off on these tangents and I always forget my thought.
I'm the same way. It's totally fine.
Could you walk me through an appointment as the physical therapist, or you wearing your physical therapy hat?
We don't necessarily grade it as far as levels of dysfunction. But if somebody said, I leak a little bit when I laugh, cough, sneeze versus my full bladder empties when I laugh, cough, sneeze. So it kind of it varies depending on how much you leak. But everybody is different, and you could have the same level or same type of diagnosis as far as your muscles are not relaxing, they're not functioning correctly, and have different levels of leaking. But like for a pelvic organ prolapse, there are different grades. So that is where either the bladder or the uterus or the rectum falls into the vaginal canal.
Oh my God.
So like a level 1 is it just kind of starts to fall. A level 4 is your bladder completely exits the vaginal opening, and you could basically hold it in your hand and have to push it back up. So with some dysfunctions, there are levels of degree of severity. Yep.
I'm just stuck. So holding my urine too long, and I know there are so many people that experience this, and you have to pee and you're holding it because you're like 10 minutes away from home, and you just hold it. And then at some point, you either don't have to use it anymore, or you lose the sensation to use it, or you finally made it to the house. Right when you walk into the bathroom, you just can't hold it anymore. Is that a part of this whole concept, or no?
The way you're describing it there's two main types of incontinence. One we call stress incontinence, and that is where you're leaking with that cough, laugh, sneeze, jumping on a trampoline, running. So that's kind of that leaking with activity, and then we call it urge incontinence, and we call it like a key in the door. Like you get home, you stick your key in the door, and your bladder says, "Oh, sweet, I'm home, I can release." So it's not because of an activity; it's because your brain learns that, "Oh, I'm at my house now, I can empty." Or when I'm pulling my pants down, it empties. Or when I turn on the water at the kitchen sink. So your brain starts to learn these triggers. So then it's a different kind of treatment for an urge incontinence versus a stress incontinence.
Wow. Okay. And I'm sure everybody has experienced both.
A lot of people have both.
Were you a physical therapist first?
Nope. So I started my life as a physical therapist assistant, and I'm a giant nerd, and it just wasn't enough information in my brain. So I went back and got my doctorate degree in PT. And while I was in PT school, we had some training. We had one class that's called Women's Health, and that's where we learned pelvic floor. And I was hooked from then on, and I've taken probably 20 courses postdoctoral degree that helped advance my knowledge in pelvic floor and pregnancy and postpartum specifically.
As a woman with children, did you experience it yourself?
No, I did not have any symptoms until after I started pelvic floor. So I actually ended up having pelvic floor symptoms in like right at graduation time. I had painful intercourse, and then I had issues after having my kids. I had pelvic organ prolapse with both of my children and diastasis recti. So I had some pelvic things after, but it's not how I got into it. But I have then treated myself since then and healed all of my symptoms.
That's a plus. You had the information readily available as you were learning so that you can diagnose yourself before you went on, and then it didn't hurt that you were a doctor and you could treat yourself, or you
Right.
could give yourself whatever regimens that you needed to give yourself at the time. As a lay person, how would I know that I experience pelvic floor issues?
There's probably 30 symptoms that I could name you that are pelvic floor. So I'm going to list a couple. Like we've talked about the urinary incontinence, the painful sex. But other things that men or women don't often realize are part of pelvic floor are constipation, hemorrhoids. Have you heard of it? Diastasis recti. It's common in pregnancy.
No, I've never heard of it.
Okay, so a lot of women have this, and I see it a lot in older age men as well. And I'm not sure if you get older age men in your listening group here, but this may trigger some of them too. So if you go to say sit up from bed or roll over and you see this bulge sticking out of your belly, it kind of looks like a football. It's very common in pregnancy, and then a lot of moms have it after pregnancy, and it leads to or contributes to a lot of pelvic floor dysfunction. So the things like constipation, hemorrhoids, painful sex, urinary leaking, all of those are all things that can correlate back to that particular abdominal dysfunction.
This is just so interesting. It is so crazy.
What it would look like to go into a physical therapy exam if you had some sort of pelvic floor dysfunction. So we sit down and we have a very in-depth, thorough conversation about all of your symptoms. And a lot of times somebody will come in and they say, yeah, I'm here because I peed my pants when I last crossed sneeze. And so then we dive deeper. I ask about your bowel habits. I ask about your sexual function. And we learn then most people, when they have one symptom, they have five. It's like it can't just be one thing because all those muscles are so interconnected. So I'll say, do you have trouble having an orgasm? And they'll say, oh, yeah, it takes forever. But that's not related. And I say, oh, but it is.
Oh,
Say,
wow.
do you have hemorrhoids? And they say, yeah, but that's not related. But it is. So all of these things play into one. So if you come to see a therapist for leaking when you sneeze and we ask 1,000 other questions, we end up treating more things because they're all related. And it would be like you coming to see me and saying, hey, my knee hurts when I jump. And then I say, does it hurt on the stairs? And you say, yes. And if I only worked on jumping, then I'm not fixing the stairs. So we have to fix all of those things in one. So the initial part is just a ton of dialogue back and forth. We have conversations about all of these things that affect your hips, your back, your pelvic floor muscles. And then we go into an internal exam. And that internal exam, it looks like one finger into the vaginal canal. And I would then say, okay, I need you to squeeze around my finger. And I would be assessing for how strong the squeeze is, how many you can do in repetition, how long you can hold that squeeze. We would do a cough, see if you have a pelvic organ prolapse. So I would then be feeling like, is the bladder or the uterus descending into that canal? And then I would feel around those muscles and say, okay, is any of this painful? So then we would get a big picture on if there's any muscle spasm, any tender spots, Is one side working better than the other? And then we do a gross external exam, which would then look from head to toe. So I check your neck posture, your shoulder posture, your hips, your knees, your feet, because our pelvis is affected by how we stand, how we sit, how our posture is, how we breathe. So it's a full body picture with the subjective part where you're telling me what I find internally and what I find externally.
Okay, for myself, I have sciatic nerve damage. My L4, L5, S1, and now just recently my S3 is suffering. For myself, posture is shot. I spend a lot of time more so bent over than standing straight up, and that is just try to alleviate the pain that I have. Whether it's sitting, it could be painful if I sit too long. It could be painful if I stand too long. It's just one of those things. Now, do I suffer from urinary incontinence? Yeah, sometimes. And like I mentioned earlier, that me and my cousin, we just laugh about it. Also, it's just like the running joke for us. And we could just say incontinence and just crack up. Or if we laugh and one of us have that moment, we'll just say incontinence, and then we'll just laugh about it. But it's really not a laughing matter. But I guess, a lot of people laugh at things to make light of the situation.
Absolutely. Yep.
For myself, with the issues that I have, with my lower back, incontinence most definitely is, a friend of mine, like one of the things that live with me. And I've experienced those moments when, oh my God, I just walked into the bathroom and I can't hold it. Wait a minute. And then it's like, can I contract those muscles to stop me from peeing on myself, to make it to the toilet to pee, or right as I walk to the toilet, it's like, it's not holding no more. It's just, and then as kids, and I guess now as adults, we do the quote unquote pee dance. It's like you jumping around to make sure that you do not pee on yourself. And all of those, can be issues of a pelvic floor disorder, huh?
Yeah, and the cool thing, and sometimes not cool, is it's not always just the muscles. So like when you describe that I walk into the bathroom and my bladder releases before I'm ready, a lot of that is a brain connection, and it's the signals that our brain sends to our bladder that we then have to fix. So it's not always just the muscle.
Oh my God, I need therapy. I need therapy.
I'm gonna give you a tip, a little trick to try next time you're like, I have to pee right now.
Okay.
I want you to try this. And you're like, okay, just got home. I'm getting out of my car. I'm gonna run in the bathroom. I want you to stop it, like when you're getting out of your car, and go up and down on your toes 10 times before you walk into your house.
Okay.
And see if it changes it. Okay. So what happens is the same nerve that talks to our bladder also talks to the muscles in our lower leg that raise us up onto our toes. And so then that nerve says, okay, I just worked for a minute. I can take a break. I don't have to work for a second. And it gives your brain that cue of, okay, cool. I now have a few minutes that I can walk in there calmly without having to pee. So try that. Or if you're washing dishes or at the grocery store and you got to walk, just go up and down on your toes 10 times and then calmly walk to the back. And then I want you to message me and tell me what happened.
Oh, absolutely. Because you know what? It's weird because I can be in the kitchen, and when I tell you I do not have to use the bathroom, and when I cut on the sink, now I have to use the bathroom all of a sudden. Oh my God, in my mind, I got to run all the way upstairs to use the bathroom when I knew clearly I didn't have to use it, or I would have used it before I came down the stairs. Oh my goodness. How does this affect my sexual activity? Painful intercourse. It could be due to the pelvic floor dysfunction. Is there a way to rectify that part? Do you treat people so that they no longer have painful sexual intercourse?
Yes.
So there's
absolutely.
a way. Okay. There is a way.
One of my favorite patients of all time, she was 60 years old. She says, I've had pain every time I've had sex with my husband since I had my daughter 30 years ago. And she came to see me for about 6 weeks, and she said, I now can have sex with my husband without pain. 30 years, Hayzel, 30 years.
That's crazy.
Isn't that crazy?
But see, I think the thing is, a lot
Gives
of
me goosebumps.
times we don't like to go to the doctor, for one. We are embarrassed by certain things that happen to us. Like, I'm going to really think about this later to say, oh my God, I've told everybody that I have incontinence, that
Yep.
So that's going to be another thing. So, we as people, we're embarrassed to talk about certain things, and if we talk about them, we might be able to get help.
Yeah. So you say, I just told all these people this. 1 in 3 women have urinary incontinence. So your listeners are probably going to be like, hey, that's me. I'm so glad you talked about this because that's me too. And it just opens up this other window for people to say, I'm not alone. So I'm proud of you for saying that.
Oh,
I think that's
thank
awesome.
you. Thank you. It's like, okay, we're going to stand up in this meeting and say, hi, I'm Hayzel, and I suffer from urinary incontinence. Oh my God, that is the craziest thing. A little bit more about yourself. So you are a doctor. You started off as a physical therapist assistant. You started pretty much probably doing some continuing education, getting some more information, and then had that aha moment to say, hey, I'm a little interested in pursuing more of this part of physical therapy. And you kind of ran with it and, became a SME in it. And for those that don't know, a SME is a subject matter expert. So now you're a subject matter expert and you help tons of people with this dysfunction that some people are afraid to talk about because it makes them seem, I'm not going to say less human, but it seems like it's that thing that makes people talk about other people in a bad way, and then that makes that other person, kind of feel self-conscious about it.
Yeah.
Your journey. Is there a time frame, and I understand everybody is different from the next person. Is there like a course of treatment that says, okay, you suffer from, like we were talking about levels before. So you suffer from level 1. Level 1 will take 4 to 6 weeks based on the fact that you will do A, B, C, and D, and then you'll be rectified. Or is there a such thing? And again, I understand every woman is different. Everybody is different. But is there a typical treatment time frame for curing, not best case scenario for anybody? Is there a typical time frame?
Yeah. So when you say curing, and there are some of these things that aren't necessarily cured forever, and it's a lifelong thing that you continue to, what's the word I want? Like, to work on maintenance therapy. But I tell my clients or my patients typically, I go through a very specific method that I created with my patients. So I work on called my MSO method. I mobilize the tissue, getting it moving. Then I stabilize the tissue and the joints around it, and then we optimize. So getting you doing all of the things like jumping, running, sex, all of the actual big important activities. So we go through these phases or these steps of care. Usually I say you're in each stage for 4 to 8 visits. So 4 visits in mobilizing, 4 visits in stabilizing, 4 visits in optimizing as like a minimum. Now, there are some people that come see me and they're like, I'm good. I saw you for 3 or 4 visits. I'm good to go. Other people, it may be 6 months. But as a general guideline, I say 4 to 8 visits in each stage.
This is so exciting and enlightening as well. I'm
glad.
So, as a woman who experiences urinary incontinence, who do not want to go to the doctor for it right now, is there anything that you can say, hey, do this at home and it may alleviate some things, but then if it doesn't work, come see me or someone like me?
Definitely. So you a link to a freebie that goes over some things, some stretches, some strengthening, and then some tips. So I would start with those. So working on stretching the tissue, working on a couple of those exercises. That's where I would start, checking out that free guide to urinary leaking, and trying those for a couple weeks, however long you're comfortable. And then if somebody's like, you know what, I'm trying these and they're not working, I need another step, then I would seek care of a physical therapist who specializes in it.
Okay. Do you do online consultations and sessions, or is everything hands-on? Now, I understand that there is a part of it where the physical therapy part comes in, but the part previous to that, do you have online sessions?
So as far as physical therapy goes, I can do virtual physical therapy treatments in the state of Michigan. As a PT, you can only treat in the state that you're licensed in. So for me, that's just in Michigan. And then I do my postpartum health coaching. I do virtually for women anywhere. And in that, so we work on pelvic floor and postpartum friendly exercises. And then every week there is a pelvic floor tip, trick, tidbit, something to work on every week. And then we also do some nutrition and some mindset things for moms as well. So I do virtual. It depends on which component you're asking about.
Okay. If, say, for instance, someone, because like I said, I've never heard of a doctor who works with pelvic floor. I guess that's because I never thought about pelvic floor before. So that might explain it. But because you're only licensed to practice in the state of Michigan, if a patient came to Michigan to see you, could they follow up virtually if they were anywhere else? They just have to have that initial visit with you in the state, correct? Based on insurance and...
Nope, they have to actually be in the state, yeah.
At all times.
Like even if like, let's say my best friend lived in Michigan and she was on vacation out of state and said, hey, I need an appointment. I could not see her unless she was physically in my state. That's how our licensure works. Got it.
Yep. Got it. For the women that are there, are most of your appointments or all of your appointments just a one-on-one if it's virtual? Well, not necessarily just virtual. Or do you do like shared medical groups? Do you have sessions where you have a group of women that might have common symptoms and you do it as a group first and then break out into individual sessions?
I do not. All of my pelvic floor patients, I see one-on-one. Okay. When I do my coaching, that is a group coaching with a group of moms that we do a lot of things together.
I'm sure I'm going to reach out again because, it's one of those things where you have questions, but you can't think of the questions until after the conversation is over. He was like, oh, wow, maybe I should have said something about that, or maybe I should have asked this question. So most definitely, I know I want to reach out again because this is so interesting to me. How could someone get in contact with you?
So my email is a good way to contact me. That's Mandi at aspirewomenshealth.com. Or I do a lot of posting on Instagram. That's Mandi_Kelso, Kelso. And then I have a free private Facebook group for moms that I do. Like I do a weekly nutrition thing. I do weekly pelvic floor information. Lots of stuff in there. Sometimes I do free workouts.
Knowing that you can only practice in Michigan, Instagram and Facebook is just all over everywhere. If there was a person like myself from Ohio who wanted to join your Facebook group or follow you on Instagram, that is acceptable?
Absolutely. Yep. My coaching program, I can see women from anywhere. I can see them from worldwide. So I have people that follow me from wherever.
I can't wait till the next time. I'm gonna absolutely have some more questions. I'm probably gonna have some scenarios like, well, guess what? This happened, and because this happened, does this mean now I suffer from? Yeah, I know that was just a
perfect.
Little bit.
I love it.
Yeah, a little dramatic here. I am so glad. Oh my God! And I knew I wanted to have this conversation because again, there are certain things that people don't talk about and certain information that people just, want to know and are afraid to ask. Or it's that Me Too syndrome that, oh yeah, it took you to bring that to light for me to be like, yeah, I'm one of those people too. So that is awesome. Thank you.
I'm glad you had me on.
Oh, yeah.
Good talking.
This is awesome.
Well, we have come to the end of this week's episode. I want to first thank you for listening to the insanity that crosses our minds. To those who partake and entertain in my conversations, without you, there will be no hanging out with Hayzel. To Platinum Way Ray and Mac of the Tracks, we're looking out for my dope beat. And last but not least, shout out to my other half for making this possible. Because at the end of the day, she is I and I am her. If you thought this show was interesting, be sure to tune in to next week's episode and tell a friend. Support the movement. All things Hayzel Green. Find my books on Amazon.com. Follow, listen, and like at hazelgreen.com. Hayzel Green on Facebook and Hayzel Green 216 on IG. 2 fingers. And I'm out. Hey, 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 hey.